Nasal cartilaginous septum. The cartilage of the septum cartilago septi nasi is somewhat quadrilateral in form, thicker at its margins than at its center, and completes the separation between the nasal cavities in front. Its anterior margin, thickest above, is connected with the nasal bones, and is continuous with the anterior margins of the lateral cartilages. Below, it is connected to the medial crura of the greater alar cartilages by fibrous tissue. Its posterior margin is connected with the perpendicular plate of the ethmoid, its inferior margin with the vomer and the palatine processes of the maxillae. 6. It may be prolonged backward, especially in children, as a narrow process, the sphenoidal process, for some distance between the vomer and perpendicular plate of the ethmoid. The septal cartilage does not reach as far as the lowest part of the nasal septum. This is formed by the medial crura of the greater alar cartilages and by the skin. It is freely movable, and hence is termed the septum mobile nasi. Cottle's line. It is a line drawn from the frontal spine to the anterior nasal spine. The clinical importance of this line is to diagnose the presence of deviated nasal septum and its treatment. If the deviations are anterior to the Cottle's line, then it is treated only with septoplasty, because the anterior structures are essential to maintain the integrity of the architect of the external nose. If resected, can lead to dorsal saddling and columella recession. Posterior deviations can be dealt by SMR. What is Cottle's test for DNS? The Cottle's maneuver (CM) is a test in which the cheek on the side to be evaluated is gently pulled laterally with 1 to 2 fingers to open the valve. This test is used to determine if the most significant site of nasal obstruction is at the valve or farther inside the nasal cavity.